Hey everybody, this is Eric Haley from Max Fitness.
Mike Weaver.
And so we're at week 9, post-op from patellar tendon rupture surgery. So we're going to go over, it's been a few weeks, so we're going to go over the progression. There's been a lot of progression since the last time we made the videos. Mike, you have anything to talk about?
I just think that week over week, you know what I mean? I see that, I don't know if you see it because you're so zoomed in on it, you know what I mean? Like, and how much change has happened over the last 9 or 10 weeks, but, really the last few weeks I've seen, like, even the change in, like, how you're taking a step down the steps, you know what I mean? From one week to another. It's just been a constant, progression in my eyes. So I think that's one of the things that I definitely, see over the course of the couple months here. So
yeah. So since the last time you've seen me, fully off of a brace. As far as everyday life, driving, walking around, doing things, like, it's pretty much normal. I just can't do athletically some of the things that I could do, not yet. But I can, ride the bike, do dynamic exercises as far as like my PT goes, the elliptical, like steady cardio things, just not running, not weight bearing, leg exercises or anything. I'm not sure, since the last time, like, you can see my legs have developed more in the quads. I can move differently. It's still, it's still a struggle. It's very much mental every day, waking up and having to take care of my knee from the time I wake up to the time I go to bed. So
how quickly you got some of that muscle back in the left leg is pretty crazy, because you could totally see the difference, right off the bat, how it was going one way, and then once you started to use it again, it really came back pretty quickly, which is cool.
Yeah. So let's see some of the things that I've been doing over the past few weeks and see the progression a little bit.
How you feeling, Chelsea?
You went for a walk.
Super close friends. Once you get to a certain age, you just don't meet on.
Something going on with that knee.
Okay. As long as you're safe. Well,
So put your foot facing forward.
That's great because of the soccer games. I haven't been going because I got rid of my favorite.
Okay.
red is enough, and I'd rather have red in here than the MSG. Now, if he says,
Do you post this on social media?
All right, so those are some of the things I've been doing for the past few weeks. It's been coming along really, really well.
Yeah, so I think there's a lot of progression there, you know what I mean? And like I said, that's one of the things that I've noticed the most is week over week how much more, Eric's been doing. But I think it's important to, point out that it's not all rainbows and butterflies, right? There are, some minor setbacks or some battles, you know what I mean, that you have been dealing with over the last 9-10 weeks here. So I think that's pretty, a pretty good thing to touch on.
Yeah, so I've been having, since I've been pushing so hard, and there is that imbalance of muscle strength within the muscles, I've been having, a few strains. I have like a calf strain, like into the hamstring, when I flex too much or when I overdo it, maybe on the bike or something like that. Will prevent me from being able to walk comfortably. I still have a lot of scar tissue in my knee, which I'm still working on breaking up. And, my range of motion, even though it's I'm at about 140, something like that. And, this one's still it's still more, but, there's still stiffness, but I think the muscle strains are probably the hardest thing to deal with, just having that imbalance in the muscles. So I mean,
What are you doing to keep staying on track when something like that comes up? Like,
Well-
what do you gotta? That's the mental battle, right? Like that's a big part of it.
Yeah, I've been pushing really hard, so I just have to back off a little bit. Foam rolling, I'm doing soft tissue work, I'm doing Graston at PT, doing some active release therapy, which helps out a lot. But it's just every once in a while when I start pushing to get to that next level, then I have like a little bit of setback because something will feel strained or like very very tight or so.
It's important to listen to your body, right?
Yeah. So even though I know one day I might have to, I'm supposed to do this at a certain time, I'll back off and like just really focus on like loosening up certain areas.
Yeah.
And, but yeah. So like that's where we are right now. We'll catch up in a few weeks and hopefully it'll be a lot further than we are right now. So thank you so much. Again, if you need anything or you want to talk about anything, it's just reach out to us. All right. Thank you so much.
Thanks.